Welcome back. With a vaccine unavailable for now, the race to find an effective treatment continues for coronavirus. There's a ton of confusion around which drugs are being considered and should be. Meg Tirrell is here now to separate fact from fiction to the extent that we can, Meg. And where do things stand right now?
Well, Kelly, things are moving incredibly quickly right now. So I'm going to tell you about 3 different programs. The first, of course, is one that President Trump tweeted about over the weekend. It's a combination of existing drugs, a drug for malaria and an antibiotic. It's called hydroxychloroquine and azithromycin. He was saying this could be one of the biggest game changers in the history of medicine. Well, people are saying we need more data. Just from the existing data, that is not clear yet, according to scientists and people in drug development. So New York is starting a clinical trial of this combination on Tuesday. Folks say there may be promise, but we need the trial results to be sure. I also want to tell you about a Gilead drug called remdesivir. This is an experimental antiviral that's in clinical trials. The company's saying they've had an exponential increase in requests for this drug on what's known as compassionate use, and that's use of the drug outside of clinical trials. Because they've had so much, they've had to create a more formal framework for that called expanded access, and they are moving over to that now. And we do expect data from the first clinical trials of that drug in April. And finally, I want to tell you about a development on some existing drugs for rheumatoid arthritis. Roche says it's gotten the go-ahead from the FDA to start its clinical trial of its drug called Actemra. Now, this is a drug that could tamp down on the immune response, the lung inflammation, in severe cases of COVID-19. So they plan to start that trial in early April. Regeneron has already started a trial of its drug called Kevzara. I just was talking with them and they gave me an update. They expect to get data within a month, so mid to late April. They say, unfortunately, the trials are enrolling very quickly, and that's unfortunate because it means there are so many severe patients in the hospital who are eligible for this drug. But they do plan on getting that data in April, so everybody is waiting with bated breath, Kelly, to see how well these drugs work.
And we're all hoping that maybe if this thing comes back, you know, next year, fall, winter, whatever, that there's at least treatments, if not maybe a vaccine available. But the interesting thing, Meg, is that the transfer of some of these drugs to help treat coronavirus, does that risk shortages of what they are intended for them, you know, in regular course of medicine?
Yes, and we are already seeing that. Data from Premier, which is a hospital purchaser, shows that the demand for hydroxychloroquine and chloroquine has gone up by so much that patients who take it for lupus and rheumatoid arthritis, those are its approved uses, are having trouble accessing it. So doctors say that is another unintended consequence of all of this attention on an unproven therapy for COVID-19.
Can they ramp that up more quickly, the production? Or is it an exotic or a rather straightforward thing?
Well, we actually have heard from manufacturers saying they are ramping up, including Mylan saying it's going to turn its West Virginia facility back on and they should be able to create millions of doses. But this is just starting. So in order to fix that problem, you are probably going to see a lag in the system.
All right, Meg, great info as always. Thank you so much. That's our Meg Tirrell.